It's a constant collaboration of the nursing staff, days, nights, of how to improve our nursing care.
Every day we talk Magnet.
Assessing a patient, knowing what they need, and then planning forward to meet the needs that they have. And then looking back, did I meet those needs? Is there something I need to do better or differently in order to make a difference in their care?
Magnet's given us that push to own our ER, to be proud of it, to raise our own bar.
In about 2006, the chief nursing officer and myself at the time realized that our nursing staff were already Magnet nurses. When we looked at all of the components, they already met the criteria, so we thought. So we decided to go on that journey and look at all of the components that were comprised in Magnet and whether we met them or not. And when we did that, we realized that the nurses did have what was needed and the organization had what was needed for us to become Magnet. So we wrote our document and we submitted it, and we received our designation as a Magnet facility in September of 2008. ANCC is the group, the American Nurses Credentialing Center, gives the Magnet designation. And what they're looking for are hospitals where nurses thrive, that we have an environment where nurses can practice nursing the way nursing should be.
I am a staff nurse on evenings and nights. Come onto my shift, look at my patient assignment. From there, I will collaborate with the day shift nurses and receive end of shift report. And once I receive all the information regarding my patients, then I go room to room and start doing my assessments and start my night. I do chair Ed Council, so that keeps me involved and up to date on nursing practice, which I'm then able to come back to my unit and further educate my colleagues as well. So we're at the bedside, we're involving the patient, which promotes responsibility of the patient, accountability for the nurse, and it's keeping everybody involved in the patient care. I've had chances where I have gone to other places and I'm still here because Hunter Medical Center offers things to promote nursing, gives us the independence to allow us to improve patient care.
We don't have a recruitment and a retention problem here at Hunterdon, and I do believe strongly that it's large in part of our Magnet designation. The average years of experience here at Hunterdon is over 11 years, and I think that that is in large part because of the leadership at Hunterdon and meeting all of the tenets that make us a Magnet facility. When we did our nursing satisfaction survey, out of 12 categories, our nurses at Hunterdon said that they were more satisfied than their Magnet colleagues in 9 out of the 12 categories, and the same in 3. Again, I think that that speaks to the nursing leadership here at Hunterdon, the organizational leadership, and to the nurses themselves who provide the best care that they can and are satisfied and happy that that they have the environment to practice that care.
My total nursing years, 28. When we initially were going through the certification, I was involved, part of the chair of governance that we have here. I was the chair of PI and Research Council. We found that through the structural organization that we had in place the structure that we needed to become Magnet. Through the CEO, down to the CNO, down to your directors, unit directors, to the support of your peers, the nursing support, we realized we are Magnet.
In those, we have 3 councils. One is Education Council. The nurses at the Education Council are responsible for educating patients and nurses and making sure that we're providing evidence-based nursing care. The Nurse Practice Council is the council that looks at our policies and procedures and our practices and makes sure that we're practicing quality care at all times. Then our PI and Research Council, Performance Improvement and Research Council, looks at the latest data, actually performs primary research and changes practice based on the research and based on the evidence. We need to be the best we can. It really is all about the patient. And if there is some gap in what we need to do to provide the best care, then that is my responsibility as the Chief Nursing Officer and Bob Wise as the CEO to make sure that the nurses have what they need to do for the patients.
Hi, I'm Lori McMullen. I'm a clinical care coordinator, oncology certified nurse at Hunterdon Regional Cancer Center. Working here, I've seen that the administration really supports professional growth, and I've been able to take great advantage of that. And I feel that from the very high up of nursing to the director here of nursing and my fellow nurses, supporting me in whatever I do professionally. It's allowed me to speak to other organizations about my role model as a nurse navigator. I've spoken to nurses in AIDS care of how nurse navigation translates into all disease processes. It's allowed me to go to Boston to speak for the Oncology Nursing Society. One of my goals is trying to engage the inpatient nurses who work in oncology with the outpatient nurses who work in oncology to really collaborate together towards the goal of improving oncology care here at our institution and to promote their professional growth.
Magnet facilities, when compared to organizations that do not have Magnet, show better empirical outcomes, falls data, pressure ulcer data. It also increases and improves recruitment and retention. It acknowledges the staff, for the nurses themselves, it acknowledges what they do every day and what they do very well every day for their patients. Our ICU had gone 28 months with no infections. 5 North, the surgical unit, had a falls rate of 0.75 over 2 years when the benchmark is 2.8. And 3 West had a pressure ulcer rate of 2.35 over 2 years with a benchmark of 4. That separates Hunterdon. That's what makes us Magnet, and that's what gets us the Magnet designation. This is something that's not a flavor of the month. This is not something that you can say, okay, we got it and now we can rest on our laurels. This is something that we constantly have to raise the bar and make sure that we are providing the best care for the patients. And again, in order to provide the best care for the patients, we need to provide the best care and give the best environment for the nurses.
Magnet has just basically brought us all up at another level as far as being proud of the hospital, proud of our work here, and that sparked people to ask questions as to how can we make it better. As far as patient satisfaction, the nurses in the ED have always been high in the high 90s, whatever we have been. We were 97, we weren't good enough, we raised it and worked on it and did some more team building within the ER, and we're up at 99 percentile now. It's very important to us because it makes us feel good that what we are doing, the patients are feeling and patients are reacting to, and appreciating that they're getting that kind of care here.
Patients have a choice of where they go. So they're going to choose the best hospitals. So it's very important for us, in order to provide the best care, to be able to make sure that we are meeting all of the increased requirements for a Magnet organization. And at Hunterdon, we do.